Well, a top committee of the World Health Organization will convene today in Geneva, Switzerland, to consider whether the current Ebola outbreak in Central Africa constitutes a global health crisis. And this comes after a 5-year-old boy who traveled with his family to Uganda from the DRC died from the disease. The Ugandan authorities later confirmed that a second person, the boy's grandmother, also died. Uganda's Red Cross Society spokesperson, Irene Nakasiita, joins us on the line now for an update. Thanks so much for joining us. Welcome to the program. What is the current situation regarding this potential Ebola outbreak in Uganda?
Well, thank you so much. What I can report about from the Uganda Red Cross context, I can say is apparently the situation is calm compared to the last 2 days where we registered deaths. And of course, everyone was on tension, everyone was on their knees, on their toes, running around to see that we have these cases actually cleared. But the situation is now a little calm, considering that even the 3-year-old child who had been confirmed positive is among the people who were repatriated back to DR Congo with 4 other members of the family. So as we speak today, we just have now to continue heightening up our response and preparedness activities as usual, as we have always done at the border crossing point and in the communities in Uganda.
Do you have any idea how many people potentially may have been exposed to these persons carrying the disease?
Well, from the initial task force meeting that was held recently, we counted about 50 people being exposed. Because the 2 patients, when they arrived into Uganda, they went to 2 different hospitals. So we had established about 50 people who were exposed. But from all these people, the medical personnel at the district level have managed to get all of them, and they have all tested negative. Apparently, only 2 people are under observation at the isolation unit in Kasese.
All right, so how concerned are you about a spread? It does seem to be contained in an area where, there's recurrent conflict at this stage. Are you confident that this is something that can be contained, or what are your fears?
Well, in Uganda, there are no conflicts, maybe in DR Congo. But like I said, at the border points, we already have mechanisms for tracking down Ebola. For example, the official crossing border points have scanners where people go through and they are scanned. And then we also have hand washing facilities. We have sanitizers that people are applying. And basically, the screening before somebody enters the Uganda is quite thorough. And of course, even those who go into the communities, we have community-based surveillance systems that we are using and mechanisms that we are relying on to be able to even track any person who might be a suspected case. So we also have ambulance systems that are helping us even to manage referrals. Basically, the water is low, apparently, and because the preparedness got us really strong, and so we believe we can contain this.
Are you confident about the integrity of your borders, that people can't cross the border except at those border points?
Well, we have several other porous border points, we admit, and one of the stringent measures that now we are putting in place is to make sure even those other small border points that we had neglected before are now observed, because we are deploying Red Cross teams at all those small porous border points that will be managing these border points during the crossing hours. So at least there are mechanisms in place, and we believe that they are effective enough.
How closely are you working with Congolese authorities? That's really the epicenter of the problem in that region at the moment.
Well, I may not speak for my government, but what I am sure of is through the arrangements of the intergovernmental collaboration. Apparently, the Uganda Ministry of Health is in touch with the Ministry of Health for the DR Congo, and we have even had the Congo Ministry of Health members as part of our coordination meetings even recently. So we are working closely with both governments because we believe, actually plus other partners, because we believe this is not a business that can be run by only one country, considering that we are neighbors and our borders are open to DRC people crossing into the country.
All right, so we're going to leave it there, but thank you very, very much indeed for that update, and we wish you the best of luck in making sure that no more fatalities happen in your country. Thanks so much indeed for joining us. That was the spokesperson for Uganda's Red Cross Society, Irene Nakasiita, speaking to us on the line from Kampala.